Good evening, everyone. In Lewis Carroll's book, Alice in Wonderland, which must be very popular tonight, I've heard it quoted several times, after she leaves the Duchess's odd household, she encounters the Cheshire Cat, perched overhead in a tree. In reinterpretations of this passage, the exchange between Alice and the cat occurs at a fork in the road. Alice is questioning which path she should take, and the cat tells her which path she takes depends on where she wants to end up. To which Alice adds, "As long as I get somewhere." The cat replies, "You're sure to do that if you only walk long enough." As individuals and professions, we are continually asking ourselves, which road should we take? Where is the somewhere we want to end up? Going back to Alice's conversation with the Cheshire Cat, as they continue to talk, he disappears and then reappears quite suddenly. He disappears a final time, slowly, starting at his tail and then moving up his body until the last visible part is his grin, which remains visible for an uncomfortably long time. As Alice continues on her way, she thinks, well, I've often seen a cat without a grin, but a grin without a cat? It's the most curious thing I've ever saw in my life. Even Alice, the protagonist in this book of extraordinary adventures, questions the illogicality of a grin without a body. Yet for a long time, dental care delivery, education, and financing of said grin, or more specifically, the teeth and surrounding oral tissues, have been disassociated from the body. How did this happen? When dental practice was at its fork in the road, is this the somewhere it wanted to end up? In the early history of dentistry, the teeth were considered medically unimportant, and their loss akin to losing hair from your head. Everyone thought they're only just teeth. If an individual had good manual dexterity and physical strength, they could repair a tooth or pull it out. This type of work attracted individuals from other trades, such as jewelry makers, watchmakers, and barbers. Can you imagine today going to Supercuts for a haircut and a filling? When did we get interested in putting the mouth back into the body? Surprisingly, medical and dental integration is not a new idea. In the mid-1800s, the idea that dentistry should be a subspecialty of medicine was not supported by most medical faculty. For them, the grin had no influence on health, a viewpoint that prevailed for a very long time. They're only just teeth. Dentists did not give up when they came to that crossroad. They picked a new path and in 1840 formed their own school, cementing the separation between the professions. And in 1867, here at Harvard, the first dental school in association with a medical school was established. Dental students took the same foundational courses as medical students, a synergy that still exists almost 150 years later. Unfortunately, learning did not go both ways, further enhancing the separation of the professions. My brother-in-law mentioned that when he was in medical school, he was taught to look past the teeth and gums to get to the tonsils. The integration of oral health with general health was next recommended in the 1920s as part of an influential report on dental education. In fact, the report even mentioned the possibility of a connection between the condition of the teeth and gums and overall health. But again, years later, the teeth did not rise to the same level of importance as the rest of the body. Again, they were just teeth. In 2000, a new crossroad for the profession emerged, the first ever report on oral health issued by a US Surgeon General. The report was pivotal as it put oral health on the nation's health agenda. One of the two major findings was the important connection between oral health and general health and well-being. The report cited research showing relationships between gum disease and birth outcomes, and between gum disease and diabetes. Deficits in learning and self-esteem among children with tooth decay and pain were also cited. The report noted that our mouth is like a mirror into our body, reflecting our overall health and well-being. A dental colleague once told me that he was the first to diagnose a patient's eating disorder because of the enamel erosion on her teeth, her outside appearance betraying any indication of the disorder. Despite my calm demeanor tonight, my dentist knows when I'm under stress by the wear on my teeth from nightly grinding. And systemic conditions like Crohn's disease have oral manifestations, some which precede other noticeable signs and symptoms. Imagine our teeth and their adjacent tissues as the canary in the coal mine of our body and psyche. So maybe they aren't just teeth. So I want to end with 2 points. First, Alice was right. A grin without a cat is most curious. Teeth should not be viewed as separate. They play an important role in our health and well-being. And second, the walk on the road to our somewhere, that is putting the mouth back into the body, has been long, yet not long enough to end where we want to be. Despite the call to action over 15 years ago, integration of oral health with general health has only recently accelerated through interprofessional education efforts, integrative training and care delivery initiatives, and enhancing dental benefits for chronic disease patients. We still have many paths to cross. Thank you.